You're going to know by the end of this video the things that you should do in order to get pregnant easily and naturally. And in case if you're stopping to this channel for the first time, my name's Amara Uzodigwe, a registered nurse midwife. So today I want us to look at how to get pregnant easily. Or before I begin, I would like to point out something. Getting pregnant is a miracle. Whether medically, using artificial, reproductive, whatever method that someone gets pregnant, to me, it's a miracle. It's a mystery. I think the people that will understand this are the people that are trying to conceive. The first one is, if you're planning to get pregnant and you have used or that you are using any contraceptive, the best thing is to stop any form of contraception that you are using. You need to stop it at the moment so that your body will regain itself, and this is especially to women. Then the second one is, if you're planning to get pregnant, you need to monitor your cycle as a woman. You may be asking me, what do I mean by this? If you want to get pregnant, you need to know your menstrual cycle. You need to know the number of days of a menstrual cycle. You need to know your signs of ovulation. You also need to know when you are ovulating. This will help you to finally know your safe and unsafe period, which you call the fertile and your non-fertile period when you are ovulating. And these videos, don't worry, I've already done the videos in my channel. You can scroll down. I will try to link it in the description. You can watch these videos on how to monitor yourself. So you need to monitor yourself and know what your system is all about, how your system works and how it doesn't work, what affects your system and what doesn't affect your system as a woman. Then the third one is, as a man who also wants the woman or his wife to get pregnant, you need to also help your wife in studying her body. How will you do this? You help her to stay out, as in to know when to have sex, when she's ovulating or when she is not ovulating. The fourth point is, you need to increase your duration of sex. You need to increase, that is, the number of times you have sex. If your husband is not living close and you are planning to have a child, you are planning to get pregnant, then your husband needs to come home, even if it is 1, 2 or 3 months, when you must have monitored yourself. You need to have sex at least 2 or 3 times in a week, and not just having sex 2 or 3 times in a week. You need to make sure that you are having this sex at the proper time, and by proper timing I mean that the sex should be either before, during or after you must have ovulated. Few days, 1 or 2 days, 2 days before your ovulation, or when you are ovulating, or 1 or 2 days after ovulation. Because what I said before is that the sperm can stay in the body of a woman for at least 3 days. So if you have sex 3 days before your ovulation, the sperm will still be there to find the ova for fertilization to occur. If you have it on the day of your ovulation, perfect. Then if you have it some days after your ovulation, the egg, that is the ova, stays just for 24 hours. So if you have it a day after your ovulation, the sperm can still find a way to meet the ova for ovulation, for fertilization to take place. And this point is one of the most important points. The fifth point is, for women, you are planning to get married, you are planning your marriage, your wedding ceremony, or your traditional ceremony, or your civil marriage, whichever one. Start now to take your prenatal vitamins, especially folic acid. Make sure that you are taking folic acid, even though is recommended for women within childbearing age that they should start taking folic acid. So you take it so that it will also prepare your body ahead of the coming of the baby. Then the another one is, this one is the sixth one. While trying to get pregnant, you need to know that pregnancy does not occur in one sex. Like, that's what a lot of people believe, but that's not the case. When you need to know that, first of all, that one sexual intercourse cannot result to pregnancy. It can do for some people, but most people, that's not the case. They may have to, as in to have sex over and over again for some months before pregnancy can occur, even when they are having sex during their ovulation. So that does not mean that once you have sex that immediately you are going to get pregnant. It doesn't work that way. Then the seventh point is you need to relax your mind. If you are trying to get pregnant, you need to relax your mind. You need to reduce stress. Anything that causes you stress can be emotional, financial, like so many things can be pulling you down, and even the thought of that you want to get pregnant, you are thinking it while you're having sex with your husband or your wife. You're already thinking, I hope this will result in pregnancy. I hope this will not be a problem. You need to relax your mind and make sure that you are not under stress when you are trying to get pregnant. Most women that are trying to get pregnant, they find out that it's only when they now said, oh, they are no longer interested, or that they just surrendered everything, remove their mind from it. That is when they finally get themselves getting pregnant. And the eighth point is, if you are using any lubricants, there are some people that use lubricants to aid their sexual life. Make sure that the lubricants that you are using, that it is sperm safe. It is sperm safe. Make sure that it is not a lubricant that is dangerous to the sperm of the man, because you may end up doing everything I said and you may not know that what is actually causing your problem is the lubricant that you are using, because it will end up killing the sperm of the man even before getting to the cervix. Talk more of the uterus. Another one is sex position. The ninth point is sex position. Some people believe that there are some sex position that aids pregnancy to occur. Personally, I don't believe in that. Even though people say it works for them, there are some sex position that makes pregnancy to take place. In a normal condition, whichever position that you take, it should aid pregnancy. The most important thing, make sure that the position you are taking with your husband or your wife is a comfortable position that both of you are okay with. So there is no position that you can say, this is what I can do to make pregnancy to occur. Then the 10th one is, you need to also know that whether you raise your leg or not. There are some people that they believe that after sex that you should raise your leg up, you should do like this, you should do one kind of exercise in order to make it to work. Those things doesn't work. When you interview some women, they will tell you that when they got pregnant, that it wasn't even something that they used their effort. It's not because of what they know. They just found out that this occurred on its own. So you don't need to raise your leg for some minutes, for some 20 minutes, whether you raise it or not. The sperm that will pass through the cervix to the uterus must have already done that even before you start raising your leg. Final one is, let me tell you, the final way of getting pregnant is also praying to God. I know people will say, no, so why will you always bring in prayers? Because initially I said that pregnancy is a miracle. So it's not even by all these things we do. There are some people that will do all these things, yet they are finding it difficult to get pregnant. So you need to pray. You need to pray while doing this. You need to pray while having sex. You need to pray while monitoring yourself. You need to pray. Prayer changes things. Don't forget to subscribe. See you next time. Bye.